Good afternoon, everyone. Gareth Presh, founder of the World Health Innovation Summit. Delighted to welcome you to our webinar on cervical cancer, and we're going to focus on Africa. I'm joined by Lamek Oyu, who's in Kenya and is the founder of Kisumu City Cancer. And Lamek, perhaps you can set the scene for us. I mean, there's a huge prevalence of cervical cancer. Maybe give people a background on what you're doing, and then we can take any questions from the audience, and we'll have one of your colleagues join us as well.
Thank you so much.
No, we seem to have had some technical faults. Hold on, he's back in. Go ahead, Lamek. Oh, we've lost Lamek again. We've had some technical issues.
To join. Am I clear? Am I clear?
Go ahead. You're clear. Thanks for coming back.
Okay. Thank you so much, Gareth, for giving me this opportunity to join you in World Health Innovative Summit. My name is Lamek. I'm the founder and director of Kisumu City Cancer Organization. It's based in Kenya, in Kisumu City. We registered it in 2016 to help in assisting cancer survivors, patients, and caregivers opportunity to navigate through treatment. Yeah, one of the things we do is awareness. Awareness, we focus on different type of cancers, including cervical cancer, yes.
And can you explain the background and the reasons why you set up the cancer groups?
Yeah, as a clinical psychologist, I've worked within the cancer center for quite a number of time, since 2011. And I came to realize that there was a gap for the cancer survivors, patients, and caregivers. They didn't understand much about cancer. And then I came about with a support group and then registered an organization, which really helps the caregivers, survivors, and patients to understand what is cancer, how can it be treated, what are the preventive measures that they can that the community can look into. And also we engage different partners, different organizations in fight or in eradicating cancer within our community.
Yeah, fantastic. And let me bring your colleague in. Stacey's joined us. Stacey, welcome to the webinar. You're doing some fantastic community engagement. You have a 10K this weekend. Can you tell us a little bit about your background and tell the audience what your intentions are?
Okay, hi everyone. As they said before, I'm Stacey Bose. I am an HPV advocate and an athlete. So basically, I started the HPV project because I got to learn that HPV is actually somehow related to cancers, and the vaccine is offered in hospitals for public hospitals for free, and most girls didn't know that. So looking at the number of teenage pregnancies in Kenya, and just looking at the number of teenage pregnancies in Kenya, and cervical cancer is like a long-term thing. I usually refer to it as a long-term thing. So I was looking at it and I was like, that's a huge number. So why not do something for these girls of my age, teenagers, to get the vaccine? And one of it was through the sports. That's why I'm having my run this weekend. It's actually tomorrow. Yeah.
Fantastic. And Lamek, this is the sort of public engagement that you kind of need from a preventative perspective, because you're bringing this to the masses. Some of the engagement that I see, you're investing in preventative measures and knowledge exchange within the community, which is very much the model of care that we're developing from the World Health Innovation Summit, to empower people, to give people the tools so that they can manage their own health and well-being. Do you see this as an opportunity for Africa, for Kenya, to actually prevent disease?
Yeah, thank you, Gareth. It's very much important to focus on primary health care, especially on prevention and promotion. One of the ways that we can empower our communities by giving them information that is needed and required at a specific time, because the reason to why cancer is becoming pandemic in Africa it's because of a lack of information, knowledge, and awareness. So what we are trying to do is to reach the community with this information, and it's high time that in Africa we are getting this in the right time. We are doing this in the right time, because the literacy right now, it's at some percentage, not as low as it used to be 10 years ago. So even the community, they are taking action, and they are taking initiative to also help us disseminate the information. And through this, such kind of engagement is when I met Stacy, a very vibrant young girl who is out to also reach out her peers. And I am very happy that Stacy is doing it. And she is one of the girls that I've met who is very passionate about reaching out her peers. This is the right time for Africa. And here we are.
Yeah, no, it's fantastic. I think you're doing the right thing. I think you've had a lot of success in the past. You've ran these events in the past. Can you tell people who are listening in across Africa, what are the opportunities? How do they get involved? Can they replicate this model? Can they, I think one of the things, we've learned through the pandemic, health is wealth. The knock-on effect of health and well-being to the economy is huge. And perhaps this is an opportunity for Africa to look at preventing disease, which then builds economic growth. Do you see this sort of run being replicated in other cities around Africa?
Yeah, very, very, very true.
Well, we just lost Lamech. Stacy, he's coming back in. Stacy, while you're there, are you encouraged? Do you have peers in different cities around Africa that are reaching out? Are you reaching out to other cities in Africa and encouraging them to get involved in similar runs?
So basically, we have a lot of different people. I think mostly I focus in Kisumu because it's where I stay. But I've been planning to take HPV vaccine to the next level, and I've been planning to move around in cities so that we can start from here. Yeah.
So, and Lamech, Kenya has some fantastic runners, to help you promote this sort of activity. Bringing health and fitness together is such an important part of the future. You've got Kipchoge, who's an amazing runner. Do you think that this again can be an opportunity for engagement as we build forward? Health needs to move the paradigm from disease management to prevention. What Stacy's doing, what yourself are doing. I mean, this is pioneering work.
Yeah, very true. You see, like one of the ways of engaging the community is bringing up innovative ideas, like bringing sports inside other activities that can bring to a community together, and then through that you share your information. Apart from getting the information from the health centers or from the doctors, from the professionals at the hospitals, you realize that the community agents, they really do a lot, especially even the community health workers. We normally train them to also help us in disseminating information to the community outside there. So when we thought of supporting Stacy so that she can also reach out to her peers, and I know the next level is to recruit ambassadors of her peers, so that we can have these young ambassadors who can also reach out to other peers. Thank you.
Yeah, I think one of the things with cervical cancer as well, it is entirely preventable in terms of, like, it's one of the cancers 90% you can prevent. WHO published a number of papers on this. Are you looking to raise awareness so that the vaccine can be disseminated? Is this the key objective?
Yeah, that's very true. That's very true, because cervical cancer is preventable. In other nations, you might find it 0 point something percent, but here in Africa, look at the Malawi case, look at the Zimbabwe case, and even here in Kenya, especially even my community, HIV prevalence is very high, and cervical cancer and HIV, right now we see there is a lot of infections, especially for those people living with HIV, the women living with HIV. So that is why we want to prevent the future generation through this vaccination.
No, it's brilliant work. What's the next steps in terms of, you have the event tomorrow, Stacey and our peers, are you doing any impact measurement? Are you like engaging with the community? Is there engagement with the local oncologists? Are you working with the local authorities?
Stacey?
Okay. As for that, I'm actually working with an oncologist and a gynecologist. I'm volunteering at Kisumu Specialist, where I get a data of women who come for HPV tests, who come for cervical cancer screening. So I'm currently doing some data in that hospital, but I'm also in other hospitals also looking for some research around Kisumu, where I have Lumumba and I have Russia Hospital for the stuff.
That's brilliant work. And Lamek, going forward, do you see further engagement with oncologists, with the local hospital groups? Are they very supportive of this activity? Presumably they're looking to prevention, and this is a great opportunity to engage with the community.
Yeah, as I said before, I've been into the cancer center. I've worked at the cancer center for 13 years, and I've been working very closely with the oncologist, gynecologist, and general practitioners, so that because one of the activities we do is patient navigation, which is very key in our organization. So we need these specialists, so that at the end of the day, when we get a client or a patient, then their way of navigating treatment is much more easier than if we don't work closely with these specialists.
Yeah, so can you just tell me on the ground what it's like for those patients who are trying to come forward? Give people an understanding of the challenging conditions, because I think that's important for people to understand the challenging conditions and the reason why these activities, such as public awareness activities through 10K, for example, are so important, because I'm sure, like a lot of people listening in, they want to understand how difficult it is. When you see the numbers there, I think 80,000 young women are diagnosed with cervical cancer in Africa, and about 60,000 deaths per annum. That's a lot of people. And this is a disease that is preventable.
Yeah, one of the challenges that we normally one of the challenges that comes in is the culture. Culture plays a very big role when it comes to reproductive health, especially here in Africa. There's some information that the community stay away from. You cannot teach them some taboos. They call them taboos that you need not to mention. Like when you talk about reproductive health. So culture plays a very big role, and that is why there is late diagnosis mostly in the rural areas, apart from the cities. I don't know, Stacey, you have something on the same.
Okay, just to add on that, I'd say it's also stigma because you find that a lot of these women with cervical cancer, the ones who have it already, are usually very scared of coming out in public because first of all the community looks at them as those ones of you have cervical cancer, you're dirty. And I think it's also a lot to deal with culture. So for having those women to come out and to accept that they have cervical cancer, it's actually a huge thing and a big deal to them. And we find that most of them are usually scared of coming out, and some of them don't even want people to come out for them, and are usually very bitter. And how palliative care comes in. I've had my psychologist who usually comes in and just helps the women accept that you have cervical cancer, but it can work out through that. And yeah, I think that's basically one of the struggles that we go through. And having just advocating for HPV, it's really hard for women to just accept that it's a huge deal, even to parents and just girls on its own. I mean, the HPV vaccine was introduced into Kenya like 2019. That's a few years ago. So having people accept that you can prevent something through the vaccine, it's very the chances of having that are very low. Yeah.
And I suppose it's these events, Lamek, isn't it? It's even this webinar, for example, which breaks barriers. You're kind of encourage people to come forward when they have symptoms at an early stage, so that actually you can put in the treatment, or, for example, encourage families to get the vaccine. So I think, like, what we're doing here today is to try and raise that awareness within the community. The outreach programs that you're doing through the 10K, that's so important, isn't it? Like, you talk about breaking the stigma. Well, you can have, when you meet for the run, you can say, well, I may have some symptoms. These are kind of ways to have a conversation, which then may lead to actually preventing disease. Is that the purpose?
Okay.
Yeah. That's very, very, very true. Yeah, that it's very, very true, because such kind of activities will really help in curbing stigma within the community, and also disseminate the information that is required. And it's going to encourage the community also to come out and take initiative in fight against cancer, or fight against HPV, which is the agent to cervical cancer. Yes.
I think having a lot of this activity, having these activities like the 10K, it increases awareness for this, because increases awareness and breaks the stigma, and just tells these women and girls that, hey, you can have it, but it's not that much of a big deal. And it also helps men and boys accept that men and boys in Africa are aware that things like HPV are not just women's stuff, because a lot of them tend to assume that HPV vaccine and all that stuff are just women's stuff. So they tend to ignore it. So having these activities and going to these community talks and just raising awareness for this stuff is just, yeah.
Yeah, I think this is crucial work that you're doing. I think it's so important to emphasize the community engagement here, the building of capacity, the trust building. I know it's difficult. We're going through a digital era. People's attention span is not necessarily that long. People want instant solutions. These are complex problems. They're clinical problems. They need diagnosis. And I think, what you're trying to do is pioneering work. Just, Lamek, if you can explain over the next few minutes, what what do you think will come of this, and what are the future plans for this 10K and for your awareness program, and how can people help and support? I think there's a slight delay. Maybe Stacey, you could maybe answer that if it's clear for you.
Yeah, I think I can answer it.
Thank you so much, Gareth. We are planning to have quite a number of activities in the future, and also take Stacey.
Go ahead, Lamek. Go ahead. We just have a delay.
Yeah.
Oh, okay, thank you so much. What I'm saying is that in the future we shall be having quite a number of activities, including making a national HPV vaccination event, whereby we are planning to have a national run marathon for HPV vaccination event. Apart from that, we are eyeing at the media, mainstream media, including visual TV. We are eyeing at radio stations. We are eyeing at community outreaches to help us reach out to as many people as possible. One of the things that I want to mention in regards to low uptake of HPV is infertility. There is that a myth of infertility for those who have been those who are vaccinated against HPV. That has really got a low uptake, especially in other community. So what I'm saying, if someone would want to support our work, it's just as simple as we need financial support. We need a platform like whatever we have received from Gareth. We need moral support. We need volunteers who can just come and also engage and see what we are doing within our community. So, yeah.
So, okay, so for those who are listening, reach out to Lamek and Stacey, give them the support. If you're in Africa, see how you can support. Also, you may be able to come up with some ideas to support your local community. Stacey, tomorrow is the run, early start. Are you looking forward to it? Are you hopeful for the future? I personally think Africa has a huge opportunity for healthcare in the future, and I'm very enthusiastic about the future. I think people like yourself will drive that, and Lamek. Tell me what you expect tomorrow.
Actually, I'm quite excited about this run because as compared to the run that we did last year, this one has a lot of changes. And with the kind of awareness that we've created in the communities, I'm expecting a lot of girls to come for the vaccine. And a lot of girls have confirmed to be coming for the vaccine. But I feel like this run, tomorrow's 10K run, is just going to give out opportunities for other runs to come out, and I'm just hoping for the best.
Excellent. Lamek, final words to yourself, for those listening in. It's been a pleasure. We haven't caught up in a few months. It's been a while since we spoke. I'm so pleased and delighted to see the progress that you've made. I truly hope one day I get the opportunity to come to Kisumu and maybe do the 10K run. That would be awesome. I'd pretty much appreciate that. But you're looking to the future. Please summarize the seminar, the webinar that we've just had, and if you have any final messages, please by all means share it, because I think it's pioneering work and we want to try and support you as much as we can.
Thank you so much, Gareth, and thank you so much for everybody who joined us. And one thing I would want to say is that just like Gareth said, that health is wealth. We cannot sit back, because you cannot feed a nation that is sick cannot feed itself. So a healthy nation can feed itself. So that is why we need to bring information to our community so that they can be healthy, and then we can put food on the table. I'm very happy. I just want to wish you, Gareth, a very lovely day, and also Stacy, we are here with her tomorrow. I will send more of photos tomorrow so that the world can see what we are doing. Thank you, Gareth.
Okay, it's been great to catch up, Lamech. For those, reach out to Lamech on LinkedIn. They're also very active on social media. Do connect with them, support their work. And personally, I'm looking very much to seeing the outcome of the run and continuing to build this momentum of support. It's very important that we look after our people around the world, that we share best practice. This is pioneering work. This is a way of engaging communities at a very, on quite a scale, actually. And I hope it's replicated around the world. I hope you've enjoyed this conversation. We'll have more over the next few months. And from me and Lamech and Stacey, we want to wish everyone a happy Friday afternoon, and we'll talk very soon. So we'll end this webinar. Thanks, Lamech, and thanks, Stacey, for